Hello, my name is Mohammed Qasim Shir, and our today's topic was to research a program which is being run in NSW for Aboriginal Child and Youth Sport. So, the program which I have been chose is Aboriginal Child and Family Centers, known as ACFCS. So, before getting into our topic, I would like to acknowledge the traditional custodians of the land and pay my respect to their elders, past and present. I extend that respect to Aboriginal and Torres Strait Islander people. So, what are ACFCs? ACFCs are known as Aboriginal Child and Family Centres, which are community-based hubs in New South Wales designed to support Aboriginal families with children aged from 0 to 8. These centres offer a range of culturally appropriate services aimed at enhancing child development, promoting family well-being, and strengthening the community ties. The main goals and objectives of this program are child development that ensures that children receive quality early childhood education and care, family support, provide resources and services that help families to navigate challenges, cultural connection, foster a sense of cultural identity and pride among Aboriginal families, and community empowerment, engage communities in decision making and program development. In NSW, there are currently 9 Aboriginal child and family centers, and 6 more are scheduled to open. Families with Aboriginal children up to age of 8 can receive help and services from the centers that are culturally appropriate. A variety of services are combined by ACFCs are such as playgroups, which are designed to promote social interaction and learning among young children. Activities often incorporate Aboriginal culture and language. Adult education programs, workshops on parenting, health, and professional development, skill building opportunities to enhance employment prospects, and health services. They provide maternity and pediatric care, including prenatal support, access to immunizations, health checkups, and nutrition advice. And they also provide family support services like counseling and guidance for families facing challenges, resources for housing, financial support, and legal assistance. And they provide early childhood education that prepares children for school with the focus on cultural relevance and support for language development, literacy, and numeracy. So, aims of ACFCs. Its aim is to satisfy the needs of Aboriginal and Torres Strait Islander children and their families by offering shared, comprehensive, culturally appropriate, and integrated care. Why are they important? Because they are important to address health, well-being, and cultural disparities faced by Aboriginal people, just like I discussed in the previous slide. So the role of ACFC is achieving in human services outcomes. The human services outcome for all children. What are the outcomes in communities? They should live a healthy life, learning, contributing, and achieving, contributing to and benefiting from economy. They are being safe and like participating and feeling culturally and socially connected, participating in decision making that affects them and leading fulfilling lives. So, what is cultural safety? In order to ensure that people's needs, requirements, and liberties are satisfied, like while they are operate within the healthcare industry, measures and regulations that acknowledge and respect each person's distinct cultural background are referred to as cultural safety. So, how ACFCs promote cultural safety? ACFCs promote cultural safety through several key strategies like culturally relevant services. ACFCs design programs that reflect Aboriginal cultural values and traditions, ensuring that services are relevant and respectful to the community's needs. Uh, Community involvement, they engage local Aboriginal elders and community leaders in planning and delivery of services that helps to ensure cultural practices are honored and integrated. Cultural competence training. Staff receive training in cultural competence to understand and respect Aboriginal histories, languages, and worldviews, which enhances interactions with families. And there's they promote cultural safety, like they involve Aboriginal staff and leadership. They provide culturally appropriate programs and activities, and they have collaboration with Aboriginal communities. Social determinants which are being addressed by ACFCs. First of all, socioeconomic status, like economic disadvantage is prevalent in many Aboriginal communities, which impact access to resources and opportunities. Employment opportunities. This program is aimed to enhance skills and provide employment support that can help to alleviate poverty and its associated challenges. Education and literacy. They, low levels of educational attainment can affect parenting practices and access to quality education for children. They also involve adult education programs. ACFCs offer educational workshops to improve parenting skills, health literacy, and to quality education for children. Then health and well-being, access to healthcare, like disparities in access to health services can impact the physical and mental health of children and families. Health education, ACFCs provide vital health services and information, including maternal and child health and immunization and nutrition. They like the next social determinant which is being addressed by ACFCs is housing and living conditions. Many Aboriginal families face housing instability, which can impact child development and family well-being. They also provide social sports networks like community cohesion. They have strong social networks within communities that can provide emotional and practical support to families. There is also family support services. ACFCs foster connections between families, promoting shared experiences and mutual assistance. So, how ACFCs address them? They, like I discussed in previous slide, they provide early education for children. They have family support services. They have health education referrals to medical services. They provide support related to housing services and employment and training services. So next we'll discuss about some recommendations. According to my point of view, these are few recommendations to ACFC. Like there should be an increase in funding. They should expand services and reach more communities. They should prioritize mental health. Like they should provide specialized support, strengthen partnership. They should ensure programs are culturally relevant and responsive, and promote intergenerational programs, connect young people with elders. Some more recommendations from policy inside. There should be establishment of a designated Aboriginal role within the DCJ ACFC team that is cognizant of the cultural requirement of the communities and center. There should be a maintenance of the promotion of integrated, adaptable, and kid-focused services recruiting practices that highlight a staff member's ties to the community, the establishment of a setting that is culturally appropriate, and service competition in ACFCs. To provide guidance to the government ACFC team on a reporting system that integrate qualitative data and comments, and establish an indigenous reference group. Take into account choices and chances to provide training programs or other staff capability building initiatives. In conclusion, ACFCs have been found to be very useful in identifying the health and well-being needs of Aboriginal people. Even though they have advanced a great deal, there are still opportunities to increase the organization's scope, enhance the quality of mental health services, and enhance collaboration with Aboriginal population. So thus, following these recommendations, it will be possible to guarantee the cultural, educational, and health development of Aboriginal children and their families. Thank you. That's all.